Dear friends, welcome back to Alpha Physio Pelvic Care, all things pelvic health. My name is Anastasia Varova. I'm practicing pelvic floor physiotherapist here in sunny Cyprus, and on this channel I'm sharing all my top pelvic floor tips with you. Today I would like to talk about another great pelvic floor device, and this is called Pelvic Wand. And I know that many people are using it, many people self-prescribe it because it's a non-prescription device. You can get it off internet, and me myself, I do recommend it to my clients, both male and female, and they have used it successfully. Very often I do get people coming with me already with the one that they have purchased, or if I suggest them to purchase the one and then they come back to me and we kind of go through it together, how we can use it, how to use it safely, and so on. So today I created a video for you. Just a small disclaimer, this is not your replacement from individual medical advice, so you use the content of this video at your own responsibility. But since it is a self-prescriptive device, I was compelled to actually shed a little bit of light on how to use it in case maybe you don't have access to pelvic floor physiotherapist at all. I also myself consult live and online, and maybe there will be a pelvic floor physiotherapist who can get through the use of the pelvic wand with you online, considering your specific needs. So let's begin. First of all, let me say a few words. This is a particular brand, and there are several brands on the market. The inside of the wand is, I think it's metal, to be honest. I haven't checked myself. It's a polymer or it's a metal, but it's covered with a completely seamless silicone, body safe, medical grade silicone. So obviously it is created for using inside, and it is safe to use inside. There are several variations now on these wands. This is the very simple plain one. There is variation with vibration and variation with hot and cold. I believe these are all great modalities, and they can be used in a different specific pelvic floor pains, neuralgias. You can try and test. I usually suggest for people to get the wand with the modality that they have probably used already. So if, for example, they tell me cold around my perineum helps me to relieve my burning sensation, I would say, well, maybe get the hot and cold one, the one that you can cool down or warm up, and use it in that way. If they maybe use the vibrator around their genitalia and that reduces their pain, I would suggest for them to get a vibratory one. In any case, there is no harm to get a vibratory one, for example, because you can use it as a normal pelvic wand without, turning on vibration. So let's have a first look at the wand. Why is the curve like this? What do they mean? How are they used? And then I'll show you a couple of positions and how you can start using the wand. If it's silicone, you can just wash it with soapy water and soapy warm water. And this would be it. It's not a sterile device. It's an obviously single person use device. So it will have your bacteria, let's say, film on it if you use it inside, but it's fine as soon as you wash it before and after the use. You do not need to sterilize it and put it any harsh chemicals, because it simply will destroy the lining of the wand. Some people will use lubrication, some people might not want to use the lubrication. If you do use lubricant, medical grade water-based lubricant, no extras, no strawberry flavor, no glitters, no nothing. The amount again depends on you. If you're very dry, you might need a lot of it. Definitely for rectal use you will need plenty of lubrication. If it's for vaginal use, sometimes you might need, sometimes you might not. This is really for you to see. What are the curves? There are two ends to the wand. This long, same kind of size wand here, this part here, and this is for rectal use, because rectum is straight, is narrower, and you can get with this part through the rectum easier. Now my model here doesn't allow to get through, but this is for rectal use. Rectum is more straight here. Now people might think, am I gonna damage something? Am I gonna, injure myself? If you are very steady using the wand, there is no sudden moves, then it's very unlikely you're going to injure yourself, because as soon as the wand gets through, you already have some muscles there, pelvic floor muscles. Some people might want to use it for a deeper muscle, so it might need to go a little bit deeper inside your pelvis, but the wand is long enough to fit inside and to reach even those side muscles or your bladder, in case you're a male and using it through rectum to do some bladder release. I had cases like this. Or if you're a female as well, so this thin end, if you're entering it slowly, if you're looking for the right spot, for the painful spot where it hurts that you need to release, there is a very, very, very tiny chance that you will injure yourself. This curvy bit is here for vaginal use. So you insert it into vagina, and the curve starts here because this length you already will be into deeper pelvic floor muscles. So if you go here and then you go inside, the curve will be already quite deep into pelvic floor muscles here. So you can find the trigger points at that area. When you get inside and you start to get into the curve, you are already getting into pelvic floor, into this area. And if I would, for example, assess someone, I actually would curve my finger and touch the muscles around. So this is also replicates this kind of curve that I'm doing here with my finger. And this is why you have this curve, in order so you can reach with the muscles without pushing against to the other side. Because if the one would be straight, like here, okay, if you go like here, rectum is smaller space, so you don't have to push up and down. But if you had this bit here straight, you would have to push very, very far against to the other side, and that would be very uncomfortable. So this curve is actually a good curve. Now, how would you use it? I usually propose to use it laying down or semi-reclined, actually completely flat. That will be a little bit difficult because you need to feel where you're putting the wand. Some people get really intimidated in the beginning from the wand, and some people have trigger points superficial, so they really don't need to go that much deep inside, or even might stay outside. The wand can be used outside. So if you're a first-time user or your trigger points are outside, you can actually use either more rounded bit here or slightly more pointed bit. I'm gonna kind of use here a ball to replicate a semi-reclined position, okay? So I'm just sitting here. And for example, I have my trigger point outside, so I'm just pressing here. Okay, it can be without clothing, it can be through the clothing. If it's an external trigger point, you can use also it on clothing. You are limited with the clothing just to the pressure point. If you want to do a bit of massage up and down, you need to do it directly on the skin with some lubricant. You can move it outside the labia majora here. You can go around perineum if you have some perineal scar and work up and down here, again with plenty of lubrication. Try not to use oil, it can damage the silicone. Just water lubricant, plenty of it. You can use it around the rectum, you can just trigger point the rectum, again if you do have some rectal spasms, or you can even use it between your coccyx and your rectum on the anal rectal ligament. Again, you can just keep the pressure, breathe, or maybe move a little bit up and down and do your self-trigger point therapy. If you do need to go inside, so I'm here laying down in my semi-reclined position. This ball wants to run away from me all the time. You start to go inside, okay? And again, you are regulating depth. If this is something for you first time, you have a lot of pain, you can just get inside, all right, and just move it up and down. I do suggest my clients first to start no movement, just the insertion, to breathe, to look at it, to feel it, to get in the notion that there is something entering your pelvic floor, and then to proceed with the movement. So when they are kind of into it and they see and they feel all right, it's safe, I'm controlling it, then they can start actually rotate it first. And sometimes this won't be even their trigger point therapy. Their trigger point might be deeper in. If they're ready to go straight into the trigger point and find it, off you go and do it. But if the person is really wary of it and they're like, oh, I'm not sure, it's painful, and they're very easily triggered with their pain, then I would say enter, breathe until you're ready to move. And this ready can be within the same session. This ready can be within 1 month. There is no timeline to it. It's a little bit similar work with the dilators, and I have a video on dilators in my page as well. Can you injure yourself with this bit here? No, you can't if you go slowly with plenty of lubrication. All right, slow, steady movements and up to your pain level. The risk of injury is very, very minimal. I would not suggest to use the wand if you have any active infection, if you had recent operations, any type of gynecological operations, if you had perineal tears after birth. Wait at least you are discharged by your doctor before you even start to use the wand or treat the area in between your vagina and your anus, the perineal body, if you want to do it with the wand. So you definitely need doctor's clearance to use devices and probably to have intercourse in order to proceed with the device. If you did have some kind of internal stitches, hysterectomy through your vagina, I would really, really recommend you to have a conversation with the pelvic floor physiotherapist, even if it's like an online conversation, just to make sure where is your pain level, where is your sensitivity level, what is the healing, so individual cases, right? If you did have any stitching going on. If you never had any stitching going on and we're talking about pelvic pain, there is a very, very tiny chance you're injuring yourself. However, if you do trigger point treatment, it can initially get exacerbated. So you might feel a little bit more pain in the beginning. I usually say within first 24 hours, and then it should settle down. If you use the wand, if you used it for a day, for a week, and it seems like making things worse, it doesn't really help you to get that trigger point release, do not suffer through it. Search for different modalities, and this should make you feel better. And if it doesn't, that means you need to look for another modalities of treatment. Now, you can sit like I am, with one leg straight, one leg bent. You can be with both legs bent. Sometimes I ask people to go on their side. Like rectal treatment would be easier even on the side. Usually you lay down completely here. You can do vaginal treatment and close your legs through the side. So here it's really up to the person. And sometimes you will have to try and test how it works for you. This is what I tell my clients, try this, this and that, and see what works best for you. We really cannot just give you, stay on your side only and don't go onto your back. That does not work. After you used your wand, you wash it thoroughly with the soap again. You pat it dry, preferably with the paper towels, so no any extra like little hair from the towel, especially that the fluffy is staying on, and you put it back in the bag that comes usually together with the pelvic wand, and you use it again. Basically, cleaning wise, you treat it as any sex toys you would treat, because of also the silicone it's covered in. It's exactly the same silicone that is used also for intimate toys. My friends, I did shed some light on the pelvic wand. I might have forgotten something, because when I get a certain client, there is always a lot of detailed questions. But again, we're going now into very specific condition, very specific perception, very specific symptoms. So I can't cover them all in one video. If you do have questions, write them down and I will be more than happy to answer them. I wish you all healthy pelvic floors, and hopefully we will not need any special devices and our pelvic floor will be healthy. But if you do need them, I hope this video helped you. Thank you very much for watching, and we will see you back very, very soon. Take care.